Thrombocytopenia is the next topic. This occurs when clients have low platelets, normally between 150,000 to 400,000. So thrombocytopenia occurs with 150,000 or less. Now, anything less than 100,000 is a major risk, and 50,000 or less is very deadly. So we say anything less than 50 is very, very risky. So the signs and symptoms. We have a huge risk for hemorrhaging, like a ticking time bomb. Any small bump or fall will cause major bleeding. So we see bleeding of the gums, tachycardia, and a really big one here is petechiae, those tiny red, brown, purple dots under the skin due to bleeding. So Hesse mentions, which sign is observed in a patient with thrombocytopenia? Petechiae. Now for the causes. We have immunosuppressants, which suppress the bone marrow where platelets are made, as well as liver disease like hepatitis and cirrhosis. You see, the liver makes clotting factors, so with the diseased liver, we can't make these clotting factors anymore. And ITP, immunothrombocytopenia purpura. This is an autoimmune disorder where the body attacks itself, decreasing the lifespan on the platelets. Now, the biggest complication, as you know, is bleeding, with a huge risk for injury. Again, like a ticking time bomb. So Kaplan mentions, the nurse cares for a client diagnosed with immune thrombocytopenia purpura. The key term here is thrombocytopenia. Which nursing diagnosis is a priority when caring for this client? So again, just look at thrombocytopenia and priority and think a huge risk for injury. Now, the NCLEX will give you lab values for various clients and ask for a priority nursing action here. So always think what kills the patient first. So clients on immunosuppressants that may need to go to surgery, or even a client who is in labor requesting an epidural, or a client with worsening cirrhosis needing a paracentesis for ascites. So for all these patients, look at the platelets here. We have a huge risk for bleeding. All are less than 100,000. Now, the cirrhosis one is less than 50,000, making that one the priority here. But all have a huge risk for bleeding. So when you're given all the lab values, always think what will kill the patient first, and then narrow down on that. It's your job as the nurse to save lives and prevent death, and the NCLEX will make sure you do. So knowing your critical numbers are vital to passing the NCLEX. Now, in terms of interventions, platelets less than 100,000. We hold the P's. So heparin, aspirin, clopidogrel, and even enoxaparin or enoxaparin. We notify the HCP next, and then we obtain vital signs. These are the priorities here. Now, in terms of teaching, we do no razors and no NSAIDs that are over the counter. So as far as bleeding teaching, let's play a segment from our pharmacology master course. Patient teaching, the big contraindication here, and to be honest, for any blood thinner, is key term active bleed, like a peptic ulcer or peptic ulcer disease. And we always avoid any patients with liver problems since the liver makes coagulation factors. So we use the acronym CHANT. C for cirrhosis, H for hepatitis, A for alcohol. Key term on the Hesse was a client just drank 6 beers. N for NSAIDs, and the ATI loves to name naproxen and ibuprofen. And T for Tylenol overdose, leading to liver damage. Now we monitor signs of bleeding, and we notify the HCP ASAP. Keywords used on ATI was black tarry stools, usually indicating a GI bleed, hematuria, or blood-tinged urine, epistaxis, or nosebleed, and even petechiae on the chest, mentioned by Hesse, and easy bruising. Now, supplements to avoid completely. No Eggos, guys, like that old waffle commercial. Lego my Eggos. E for vitamin E, G for ginseng, ginkgo biloba, and garlic, and O for omega-3s, and the S is for St. John's wort. Lastly, we avoid trauma, so the big key terms used on the Hesse. No small rugs or dim halls. Always well-lit hallways. No brushing hard, we use a soft bristle toothbrush. no flossing, no alcohol-based mouthwashes, no razors, only electric shavers, no constipation, only fiber and fluids, guys, and no contact sports. And we always wear a medical alert bracelet. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos.